healthcare is an issue that's been the focal point of the last several elections. And with consideration to issues like access to healthcare, our insurance system, drug costs, general healthcare costs, what would your approach be in regards to mending our broken healthcare system? Judge Gray, you've got 2 minutes.
We have inflicted so many encumbrances upon our system, basically done politically. You know, we should be allowed to do telemedical work, to unchain these things, to have healthcare workers. One maybe small thing, but would certainly reduce the cost of medicines, is to have, okay, today we have prescription drugs and over-the-counter drugs. We should also have behind-the-counter drugs, so pharmacists could in effect talk with the patient one-to-one and then tell him, her, what drug, what prescription would work the best. If you have to go first to a medical doctor, it just drives up the cost. Artificially done by the government. No, the government does not create these things. The FDA, you know, by the way, it is keeping pharmaceuticals from coming on the market for 10 years, and as well as it costs something in the order of $2 billion. Look, if a pharmaceutical is working well enough in Germany, that really ought to be good enough for us. And if it isn't, then use the civil justice system to hold people accountable, but get the market out of it. We have simply seen costs unnecessarily skyrocket because we have thwarted competition. Back in the 50s and 60s, we had it. And then, you know, basically what we're doing, do you think that the veterans are being well served by the VA hospital? Do you all want to be served by the VA hospital? I don't think so. Do you want to be served by your family doctor where you know in advance what the costs are going to be? Today they're hidden. No, that should be open. So bring in that competition. We have really good medical care for reasonable quality prices in two areas today in our country, medical. Number one is LASIK eye surgery, and the other is cosmetic surgery. Why? Because the government's not involved. Learn a lesson. Go back to that system where we will again get quality. We'll get excellence. That's the libertarian way.
All right, thank you, Judge Gray. The next response for the healthcare question will be Ms. Jorgensen.
So the healthcare, let me start. So the healthcare in this country is a special interest-driven, poorly run system depriving people of high quality care. As president, I would work to remove every government interference in the healthcare industry, moving us toward a 100% free market. Now, of course, we need to shut down the FDA, and that's especially important with what what's going on right now. Without the FDA, we would have had tens of millions of test kits. You could just walk in and buy them, or you could get a test kit without a prescription. What we had was test kits made in this country, sent to other countries that we couldn't even use. Also, drug creation is also highly suppressed. Yes, we absolutely need to have a free market. I was in a third-party debate last March in which a socialist said, we got to get the profit motive out of medicine. Doctors are just doing it for profit. And my response was, if you look at the LASIK industry and you look at cosmetic surgery, you see prices go down, quality go up, because it's free market. So I said, you better hope that your doctor wants to go after the profit, because that's how you get innovation. That's how you get lower prices, because they have to compete against other doctors. They have to offer better quality because they have to offer better quality than their competitors. If we had a free market system, people could afford to go to the doctor. They could go to a clinic at 11 o'clock at night and not have to put up with the emergency room. They would get much higher quality with dramatically lower costs. In fact, healthcare would be so low that people would only want or need catastrophic insurance, similar to what we have in car insurance. And that's what we need to move to right now. I think it's past the 2 minutes.
My apologies. I had a microphone issue going on there. Dan Berman, you're next on the healthcare issue.
Yeah, so I think I agree with everything Joe just said. Government is creating all these problems. We need to completely get rid of the FDA. Did you know that there's only 3 manufacturers of insulin that are allowed to sell in the United States, but there's 47 worldwide. You go to other countries where more can sell and it's much cheaper. So there's a company in the United States that manufactures insulin, and they'll sell it here in the United States for $100. They'll also sell that same exact quantity in Mexico for $12. But guess what? You can't go to Mexico and bring it back with you because that's illegal. You can't order it and have it shipped across the borders. Why not? Well, because they know that they can get $100 from Americans, but not from Mexicans. So the only way they can keep that price up and keep people from competing with lower prices is by locking down the borders and saying, well, you can't import drugs from other countries, even though they came from this country. That's how they do it. Here's another one. I've got a friend in Idaho who lives in a small town, and there were some investors who wanted to build a new hospital. What's wrong with that? A new hospital, more beds, more competition, lower prices, and especially during this COVID crisis, wow, all we're doing is complaining about how we don't have the healthcare capacity because there's not enough hospital beds. Well, the government there said, oh, you want to build a new hospital? Well, you need to have a certificate of need. What does that mean? Well, you need to prove to us that we need another hospital. And even though it's your money that you're going to lose if your hospital fails because you have no customers, you have to prove to us that we need it just so you can build it. This is what the government does. They are literally choking us with denying our access to healthcare. They're literally strangling us to death by saying you can't have medication, you can't have access to doctors, you can't have access to healthcare. There are doctors in this country from all over the world that are more than qualified. In fact, they're probably better qualified than half the doctors we have in this country, but they're not allowed to work. Why? Government regulation. We got to get rid of all that nonsense. We have to allow people to actually do work. When people are ready, they're there and they're able to help people. We need to let them, we need to allow them to be able to do that.
All right. Thank you, Dan Berman. Berman Supreme, how would you mend our broken healthcare system?
Yes, well, my platform includes, of course, 1 apple per person per day, free Band-Aids and aspirins, and if you are really, really sick, we will put you into Mitt Romney's car carrier on top of his car and drive you to Canada. Of course, that's facetious. I believe that the important thing to understand currently is that obviously the costs of the medical establishment are grossly overdone. 30% of such costs are purely bureaucratic in nature. The insurance industry has certainly skewed the cost. The big pharma monopolies have done such things, and the government involvement in the medical industry itself. Some possible solutions certainly include subscription-based plans with primary physicians, more transparent pricing, which would allow consumers to make better decisions, reducing the FDA regs that prevent easy access to many medical things. And we would certainly allow consumers to purchase prescriptions from a worldwide market. So there's many possible ways to help bring down the cost and reform the healthcare system. It is indeed very complex. But I would also like to point out that there was a time in not too distant U.S. history where people willingly donated money to their religious institutions. They tithed 10%, and these religious institutions built hospitals and charity hospitals to take care of those who needed such services. So there are certainly other options available. Thank you.
All right. Thank you, Berman Supreme. And we are going to go on to Mr. Kokesh.
Well, I'm glad I get to go towards the end on this one and can just say I echo all of the great sentiments about the complete separation of government and healthcare. I would only add an important statistic from Dr. Mary Ruwart, who in her analysis has shown that the FDA is responsible for over 40 million deaths just in its manipulation of the prescription drug approval process, getting unsafe drugs on the market and preventing life-saving drugs from being out in the market. Now, I will say, Dan said something that was very disappointing. He said, you can't do it because it's illegal. Well, I've done it. Being illegal didn't stop me. And I will always do what is right over what is legal. And I think it's important that we have a candidate who can live these values in civil disobedience and isn't going to accept that framing. And I know I'm just being kind of a rhetorical stickler because I know Dan is on the same page with me here, of course. And I'm also kind of disappointed to hear Vermin Supreme walked back his mandatory toothbrushing, little flip-floppy there. But I want to thank Judge Gray for bringing up the issue of the VA and veteran suicides. This is something that is a very important issue to me as a combat veteran, as someone who faced this myself when I went to the VA and told them I was having trouble sleeping when I got back from Iraq. I walked out of there with a little brown paper bag, 5 prescriptions. 3 of them had suicide listed as a side effect. And if you hear Medicare for all, what you should be hearing is VA for all. It's a disaster. I ran a peer support group for veterans dealing with PTSD called Homefront Battle Buddies when I was active with Iraq Veterans Against the War. And if you don't have a serious solution to the problem of veteran suicide, you shouldn't be taken seriously as a presidential candidate. The answer is simple. Privatize the VA. Give every veteran in America 1 ownership voting share. Get the politicians, the bureaucrats, the pharmaceutical special interests out of the way, and the drug war. Of course, give us the freedom to Medicaid as we see fit, the freedom we allegedly fought for. And I guarantee you are not going to have 22 veterans committing suicide a day.
Thank you, Mr. Kokesh. Jacob Hornberger.
I grew up in the poorest city in the United States in the 1950s and 60s, Laredo, Texas. Every day, doctors' offices were filled with patients, most of whom could not pay, and the doctors knew it. Some of them were from Nuevo Laredo, Mexico. And there was never a case where a doctor turned away anybody for inability to pay. The doctors just treated people because they believed that was part of their duty as doctors. And nonetheless, they were still among the wealthiest people in town. This is what a free market does. It combines profit seeking as well as helping people on a voluntary basis. I have a dentist who's now retired. He and other dentists got together every week and provided free dental care for the poor. Then Medicare and Medicaid, the 2 programs are the big elephants in this room and in this debate, came into existence. And that's what caused the greatest healthcare system in history to just be broken down. That artificial demand is the root cause of the out-of-control healthcare costs that started bankrupting America. And that was the root of the perpetual crisis. Decade after decade, they started calling for reforms, reform this, reform that, Obamacare, health savings accounts, all these reforms until they finally said, we need full socialized medicine, just like in Cuba and North Korea. There's just one solution to this. I've been saying this for 30 years. This is not a broken system. It's an inherently defective system. Get government out of everything. Does that mean that seniors will be scared? Of course. When this socialism scares people, it makes them dependent on it. They think, oh my gosh, what would life be like without my socialism? It'd be the greatest thing in the world. Healthcare costs would plummet like they were in the 50s. Nobody needed insurance because healthcare costs were like going to the grocery store. And that's what we need to restore. The problem is magnified now with this coronavirus crisis, with the central planning aspect of this socialist system. There's only one way out of this, and that's a free market healthcare system. Total free market. That is our heritage in healthcare and everything else.